Mr. President, I come here today to support the budget put forth by the Democrats and their resolution, led by the very able chair, Senator Patty Murray. We are showing that we can govern. Yesterday, we passed the continuing funding resolution in the United States Senate. It passed 73 to 26. It showed a bipartisan resolution, a resolve to make sure that there is no government shutdown, slow down, slam down. And now, as we work on, we now have to look ahead to the fiscal year 2014. I'm going to salute Senator Murray for what she has done through her committee. First of all, she's dealing with sequester, that draconian approach that is going to shred government, but most of all, shred opportunity and place our fragile economy in jeopardy. And she's done it in a balanced way. At the same time, she's protected seniors, veterans, and our most vulnerable by making sure that she's looked out for Medicare and Medicaid. And contrasting the Ryan budget, she also showed that she and our budget is not going to throw women and children under the bus. I think she's done an outstanding job, and I'm going to support her. As we look at what we need to do here in the budget, I was appalled, first of all, to see what the Ryan budget did. Women across America have to balance their family budgets. They know America also has to get its fiscal act together. But the entire Ryan budget places the whole burden of drawing down our public debt on discretionary spending, preserve tax breaks and tax earmarks, and further squeezes those fiscal priorities that impact women and children, impact education, impact empowerment. And I think what we have to offer here offers a far greater vision. One of the things that I'm deeply concerned about is its impact on women's health care. The senator from Michigan has spoke about it. We worked on making sure that when we were working on the Affordable Care Act, we acknowledged the special needs of women. And we were appalled in hearings that I had that women were paying more for their health insurance than men of comparable age and health status. We were paying a gender tax. We were paying a gender tax. Now, the Affordable Care Act, disparagingly mentioned on the other side as Obamacare, affectionately mentioned here as Obamacare because the president does. Our legislation that we passed in the Affordable Care Act eliminated gender discrimination in the insurance industry, that you charge people you don't penalize them because they are a woman. Then we got rid of the punitive practices in insurance companies, one of which was to deny children, the families of children with pre-existing conditions, health care. That meant if you had a child with autism, if you had a child with cerebral palsy, you couldn't get health insurance for the rest of your family. Punitive, harsh. We got rid of that. And then there was the way they treated the women. Simply being a woman, as others have said, was a pre-existing condition. We were appalled in our investigation that showed in 8 states you were denied health insurance if you were a victim of domestic violence. So you were battered in your own home and you were battered by your insurance company. Again, we got rid of those punitive practices. But the Ryan budget gets rid of the Affordable Care Act. So all of those reforms, increasing universal access to the working poor, getting rid of the punitive practices of insurance companies, ending gender discrimination, will be vitiated. It will be canceled like it didn't happen. Now, during their campaigns, they say they wanted to repeal and replace. Well, Paul Ryan repeals, but he doesn't replace. And you know what? we don't need to have it replaced. We need to keep the Affordable Care Act in place, moving America in the right direction, and helping health care be affordable both to families and to business. We cannot allow the Ryan budget to stand. But just being against an idea isn't good enough. And this is why we support the Murray budget, because she preserves the Affordable Care Act, and she continues to emphasize those reforms that we made in quality and prevention and integrative services. We know how, through those quality initiatives, we can save money and save lives. Others will also speak about Medicare. I cannot believe that we're going to replace Medicare with a voucher and a promise. So let's get rid of, not deal with the health care needs of the elderly. Let's get rid of the financial needs of the federal government. So we rather protect billionaires than protect senior citizens. I think we've got our priorities wrong. Others will speak to Medicare. I'm going to go to Medicaid. And I'm going to speak to Medicaid because of our knowledge about who is on Medicaid. 1.8 million seniors are in nursing homes. What is Medicaid? Medicaid is the only safety net that the middle class has when, through the ravages of Alzheimer's, Parkinson's, or other chronic debilitating disease, when you must turn to a long-term care facility, that you have a safety net to help pay the bill. And in order to qualify, you have to spend down. I was a leader here 25 years ago in trying to reform the spend-down policy. 25 years later, we've made no reforms. We've had plenty of attacks, but no reform. We cannot turn Medicaid into a block grant. It's going to endanger, really, the ability of sound nursing homes, either by the private sector or faith-based in my own state, to look at how are they going to fund this. All we're doing is funding our problems with public debt onto the states. Many people here talk about, oh, we've got to go to the governors. Well, all we're sending to the governors is more unfunded federal mandates. We cannot do this to Medicaid, and we cannot do this to the middle class. And instead, we should be investing in research. Research. And I say this, my father died of the ravages of Alzheimer's. We had to spend down the family savings that he had earned working over 60 or 70 hours a week in a little grocery store. That's not only our story, it's the story of over 1 million people. But what could we do? You know what? I felt so bad for my father, and I felt worse that even though I was a United States Senator, even though I could get Nobel Prize winners on the phone, even though I was an appropriator, there wasn't the cure, the cognitive stretch out for him. We've got to invest in the research. We're on the brink of incredible breakthroughs in neurological science that could help either find the cure for Alzheimer's or do the cognitive stretch out. We've got to spend money to save money. Let's put the money into research. Let's deal with Alzheimer's, Parkinson's, Lou Gehrig's disease, those debilitating things that break the family budget, break the family's heart, and also contribute to our public debt. But we can get there if we make wise and prudent insurance. And most of the people in nursing homes are really primarily women over the age of 80. And what are we going to do? Are we going to abandon them? So, Mr. President, this budget is unkind to women, but it's also unkind in terms of, and children, in terms of the opportunity structure. The Ryan budget caps and freezes Pell Grants at $5,645. It requires families to make less than $20,000 to qualify for a Pell Grant. That means that many people who seek Pell Grants are single mothers. And there's a recent data out that shows so many of our families now, 63%, are in single-parent households. And it could be the single mother or a single dad, but someone who started out life with hopes and dreams, and now she has big responsibilities. Many want to turn to higher education, particularly the community colleges that offer gateways to better jobs in the new economy. In my own state, that would be an associate degree in nursing, in pharmacy tech, and in lab tech that can keep people in the middle class, an affordable living, and so on, and an affordable educational gateway in community colleges. We should be expanding the Pell Grants, not shrinking them. It's a new economy, and it's a new family profile. You know, I could go over this line item by line item. I know that others will be talking. But when we look at women who need health care for themselves and for their children and for their aging parents, the so-called sandwich generation, the Ryan budget vitiates it, but the Murray budget has a way to deal with this. For education and opportunity for both our children and our workforce and our community college, again, the Ryan budget shrinks opportunity and shrinks the ability of people going to the middle class or staying in the middle class. I think that the Ryan budget is not only is a bad prescription for America. And the way I want to deal with the Ryan budget is replace it with the sensible, balanced approach that looks out for the hopes and dreams of the American people and is not protecting lavish subsidies and lavish tax breaks to subsidize corporate jets and others. So I salute the senator from Washington State for the great job she's done. I look forward to further debate in doing it.